Thank you for being here today for our webinar, Photomedicine for Home Treatment, Laser Therapy, and Light Emitting Diodes. I am Dr. Narda Robinson, DO, DVM, MS, FAA, and founder and CEO of Curacore Vet and Curacore Med. So today's webinar is mainly for instruction, general instruction, non-specific for anybody's animals, but I'm targeting it so that clients can understand more about what we're doing with photomedicine. For some people, it will be a little bit too complex physiologically. For others, you will get it. And I know that we have a lot of veterinarians on the webinar as well, which I'm really happy about. And if you think that this would be suitable for your own clients, then feel free to have them watch the um, recording that will be on YouTube, on our YouTube channel, and on our website at the Wednesday webinars at high noon in Mountain West page. So that's what this is geared for. So for some of you that have been through my courses, you may find this, a little too rudimentary, but I think it's always good to review the basic concepts and be able to enumerate the mechanisms on your own for your clients. So what we're going to do today is see Sammy, pretty Sammy girl, and I am going to cover 5 basic topics, and that's going to be what is photomedicine. So it's not just the joy of taking pictures as a photographer. It's actually using light, which is a photon. So photomedicine. What is it? How does it work? What does it treat? How could somebody implement it for their own animal? And where can you obtain equipment? And the equipment then that I will be covering are not the big high power class 4 lasers. And I do know that you can probably obtain some of these, like you can obtain so many things online. But if you did get a high power laser, you're risking your animal's health and well being. These may not be up to par devices. They might not have been checked out. There's a lot of ifs about that. And another reason I like to empower clients to treat animals on their own in between veterinary visits is that there's so much helpfulness with light emitting diodes, and we'll be covering some of those. I have some examples here, um, if you can see that without blasting things out too much. Then and see, you don't have to wear eye protection, but you see I didn't either, because it's not a laser. It's not going to, and I didn't stare at it. You never want to stare at it right down the barrel, but um, that's the other value, is that you're not going to give anybody in the household retinal damage. None of us want, again, to stare at that beam for a long time, but the joy of LEDs is that you bypass that real big risk to retinal damage, as you would have with a class 4 that would get in your eye. So that's a nice thing. And we'll talk a little bit about the differences between lasers and LEDs. There is also a home laser, a low power laser. Well, it's a super pulse laser that has a high power, but it's a class 1M. And so that means that you don't have to wear eye protection with that either. But again, with any of these, we don't just stare at the beam and do ourselves in that way. So I'll have 3 different devices, including the one I just showed you, about equipment that you can obtain. 2 of them for less than $200. The other one is going to be for more. So what is photomedicine? We just talked about it. It's photons, so it's doing some kind of treatment with light. So in this instance, this cat is enjoying some laser therapy, possibly to the hip region, and that's a fairly familiar device to us veterinarians. And this is key. You really want the laser treatment to be enjoyable. The cat doesn't look the most happy ever, and I'll try not to use the mouse like chaotically, but here, if you can follow it around her back, if you see, if this is indeed fur flattening, that would make me quite concerned that this cat's entire back has just a lot of myofascial soft tissue restriction that is causing that fur to be all tamped down. And so in our courses, and those of you online here that have been through them, you realize that what we would encourage as this cat's treating veterinarian is to do a palpation exam from the head down the back all the way to the tail, the legs, and the thoracic limbs as well. So the pelvic and thoracic limbs, trying to get around the trunk, but doing a fear-free, cat-friendly type if you have that kind of training. But just very gentle and making them feel safe and trusting because you would act in a way that would have earned that. And so if, for example, we did determine that this cat had hip discomfort, we wouldn't probably stop there. So as the treating veterinarian, it's not a point and shoot. And that's again what I instruct the people in my photomedicine courses about is that we're not just going to turn on the device and apply the treatment and wait until the buzzer goes off and shut off the device and say bye. It's much more complex than that if you're going to do a high level of photomedicine or laser therapy or LED treatments, because we would want to know, okay, what kind of compensatory patterns are there in this cat? If there was indeed sacroiliac or hip problems, where does that extend to? Is it coming down the limbs? Is there compensation in the front limbs? So there's so much to be cognizant about, and as well as what type of photomedicine do you want to use and what type of wavelengths. And so some of that we're going to talk about today, but there's a role for the veterinarian to do the treatment after doing the diagnosis and understanding the full complexity of the situation, and then a role for the client to follow up at home under the instruction of the veterinarian so that the veterinarian can prescribe or guide the client about what types of wavelengths you need, what's the length of treatment, where are you going to apply the treatment, where are you not going to apply the treatment. So we don't ever want to use laser on a tumor, especially a cancerous tumor, because as we'll see, one of the big helpful things about the mechanisms of laser is that they speed tissue healing, and so they will help with cell division. There are a whole bunch of helpful things that laser does that are also what could conceivably, with no proof yet, but increase the likelihood of cancer growing as well, because it's that cancer is regeneration just kind of out of control. But in a controlled fashion, that's where we get healing. So much more to know. And if you think that, photomedicine just sounds like a strange word and it looks like magic where you have a magic wand and you're just going on the skin or wherever you're doing, how can that do anything? Well, for what, about 100 years or so, people have been helping babies with neonatal jaundice, help to eliminate their excess bilirubin. Now we use the blue light treatment, but in poor countries, they will actually use sunlight with special filters that just allow the desirable wavelengths of light and keep out those harmful ultraviolet rays. So there's all kinds of things you can do with light. Then there's the seasonal affective disorder treatment that you've probably heard about. So there's the psychological component of certain or abundant types of wavelengths with a certain type of intensity. Then there's blue light. I mean, this looks like a funny kind of mask, but actually, dermatologists are using blue light LEDs. So when you see these each of these little lights, like maybe under your counter in your kitchen, those are each light emitting diodes, and they have a certain wavelength which gives them that color that we can perceive, as well as an intensity. And for patients of a dermatologist that have acne, you would lay with that on your face, and that would have some anti-infective potential. And then the photos that aren't mine or a colleagues, they are stock photos. So this was a stock photo from Shutterstock. And first of all, in our courses and acupuncture and everything, we don't like to encourage treating horses with cross ties like that. So that's the first thing. So this may be some kind of infrared. It's emitting some kind of red light, but I just wanted to show you that it is definitely used in horses as well. Of course, what else wouldn't be right here if you were trying to get the photons into the body is having all this tack on the surface, because it's not going to penetrate that. So there's skill in delivering this as well. Speaking of skill and intellect, cats are very good photomedicine self-users because they self-select to be in the sunbeams. And surely we want to avoid UV overexposure for them, especially the white ones. But why do they gravitate to the sun in addition to warmth? Well, there are abundant wavelengths in sunlight. Many of them are in the near infrared section of that electromagnetic spectrum. And that can be deeply penetrating and quite healing, and just make them feel all the more unrestricted in their motor movements. Their fascia probably loosens some. If they're arthritic, that probably helps them as well. So, but how does it actually work? They may not be able to precisely elucidate the mechanisms, at least insofar as we know it. But if they could, they would probably say something like photobiomodulation. And that's the words that the humans are using now. So photo, again, referring to photons, bio, because it's that interface with the biology of the tissues, and modulation, because just like acupuncture and even massage, the fact that it does neuromodulation, the modulation is bringing the body back into a balanced state so that the self-healing mechanisms can do their thing and we restore homeostasis physiologically. So it's really the engagement of these photons that are coming out and coming into the tissue, and then what's going to happen from there. So with any type of treatment approach using light, we want it to get, again, using, this is something called a TEND light. We want to not just have it on the surface here, but we want to make sure, if I shut off all the lights, you'd probably see it come through my hand here. We want to make sure it's getting to the desired tissue depth. If I had, let's say, a cat scratch on my hand, I might just be interested mostly in that superficial treatment. But if I had arthritis or joint problems, fracture, if I had muscle pain or ligament pain or something with the fascia, I would want it to definitely get further in, especially with the nervous system. And when we're advising people to use photomedicine for spinal cord injury, for peripheral nerve injury, for diabetic neuropathy. So all kinds of reasons why we want that light to go deeply in. So we can select certain devices that have the optimal wavelength to get more deeply into tissue, or focus it more superficially if that's what we want there. So the difference between the sunlight and the LEDs and the laser is that with sunlight, as I said, you're getting all kinds of different wavelengths. And you're getting a lot of ultraviolet light. We're not getting that with the therapy lasers. So here is one of my therapy lasers that is on loan to me, that is the same manufacturer as we'll be talking about later. And then this is an LED light that, if you can see that, I don't know if that shows up green to you, but flashes on and off. So this is an LED. And this is a device called LumaSoothe that actually has not only the green light. I guess I can show this to you if you don't have a seizure with the flashing on and off, but maybe you can see that. And that's another risk with the flashing on and off, is if you are prone to seizures from flashing lights, probably use ones that don't flash like that. But in addition to the green wavelength, that one also has what's called a near infrared, and that means that it's in the not visible spectrum, and we'll look at that a bit more. And so the difference between lasers and LEDs is just how the photons come out. Are they really strictly coming out in one beam, or are they sort of not necessarily the same exact wavelength, and they're kind of getting a little scattered? But once you enter the tissue with the light beam, there's a whole bunch of scatter that happens anyway. So it's really not that big a deal, but you do want to make sure you have enough photons, or apply it for enough time for it to actually have a good effect. So here is the visible spectrum that we're working with. So when you just saw green with that one LED cluster, that was in this part of the visible spectrum. So if we go and look at the top, you see that we have short wavelengths here at the left, and they go increasingly long as we get over to the right. And this electromagnetic spectrum spans a whole bunch of things. We have the ionizing radiation, gamma rays, which could be very dangerous, your X-rays we use for radiographs over here. We have the ultraviolet light, we have UVA, UVB, UVC, and that, if there was an intact ozone layer around the planet, then that would be filtering out even more of the ultraviolet light. But typically, a lot of that should be being filtered out. And then this tiny little narrow band here, this rainbow right in through here, that's the light that we see. You see how narrow that is. And that, if we look at the bottom here, we see that that's about maybe 375 nanometers or angstroms, all the way up to about 750 or so, 735 angstroms here. So those are the wavelengths of light. So if we come up back to the top again, a wavelength, from one trough or peak to the next, that's your wavelength. So very, very tiny along this whole spectrum. And then it becomes non-visible, and we have this infrared band here. And so near infrared, which you'll see designated as NIR, that is going to be near the visible light spectrum, but it's down and through here, probably up to about 1010 or so on the infrared, or 1030 maybe. But beyond that, we're getting way past light, and we're getting even into radio waves. So that's the literal spectrum of light that we are dealing with, and where we are along that whole kind of just stuff that is happening all around us that we often don't even know about. So what is a photon? So the photobiomodulation, so what's a photon? It's a packet of energy that moves at the speed of light. So the more photons you have, the brighter. And they have, if you remember in school, they have both wave and particle characteristics, and they are the carrier of the electromagnetic force. Remember, we just looked at the electromagnetic spectrum. And so here on the right, we have different things that a photon can do once it hits a surface. So again, I just like, this is a nice thing to use here. So I am putting photons into my hand, and they can do several things. They can transmit right through. If I showed you it and you could see it, then some of them would be coming through. You'd see that. They can get adsorbed, so into the tissue. They can diffract. They can bounce off. They can refract or scatter. So a lot of different things happens. And so the amount of photons that you're putting into the tissue, they're not exactly going to go right directly where you think you want them. And so some people might argue that for overcompensating and giving just a little bit more than you might think you needed, because they're going to go this way and that. But there is a consequence to having too much light delivery into tissue. And maybe you can, think of a really powerful LED flashlight that you're holding on. That's going to heat up quite a bit. And some of these class 4 lasers are getting so powerful that I just hear about it all the time. I mean, if you're strictly following certain preset parameters, and it's just, I hear it. I've used these preset parameters. It's just too hot a lot of times. And there's one unit that I even had to go down to a quarter of the preset intensity. It was just too much. I mean, if you are working with animals and you are sensitive to their behavior, and you are picking up when they have fear, anxiety, or stress, if you're fear-free, but also they're looking around, they're licking their lips, they may be yawning. If it's a dog, they want to get away from you. That should not be happening with laser therapy. Laser therapy should be enjoyable, and they should be relaxed, and you don't need 2 technicians to hold them down. I've seen that as well. This is something it should be safe and very well tolerated. And for that matter, for the clients that are watching, I would say you should be there when your animal is getting treatment, because if you see that they are uncomfortable in any way, you need to intervene and stop that. And that's why also that if that was happening at a practice that you had been going to, and you decide that's not for me and that's not for my animal because that's not comfortable, then it doesn't mean that your animal can't get photomedicine. And that's the beauty of having these options, these LED options. And then, I'm going to be encouraging you to get a diagnosis from your vet and to have them guide you. But if you're not comfortable with what their practice is like, I mean, that's up to you if you want to stay or not. Anyway, moving on. So how does light affect tissue? So you're pouring light into the tissue, and then what happens? Does the tissue care? Well, the rubber meets the road where the light hits a chromophore. Okay, so what is a chromophore? A chromophore, so chromo is that color, or meaning that wavelength of light, and a phore, an opening to it where it's a section of a molecule. Now, this is where it gets a little more intense for some of you maybe, but a section of a molecule that's in the tissue that will absorb light of a specific frequency. So we just saw some red blood cells. Red blood cells don't have mitochondria, but they do have hemoglobin. Hemoglobin is an example of a chromophore that when light hits it, it will change its shape a little bit. So this is a physical, chemical kind of interaction, and that can have downstream biochemical effects. The main chromophore that we are interested in talking about with tissue healing, support, anti-inflammatory effects, that's going to be an enzyme called cytochrome C oxidase. And that lives in mitochondria. And these are sort of artist representations of mitochondria that, if you again remember to your high school biology, those are the powerhouse little organelles of the cell. And they are generating the ATP that keeps us alive and helps the cell perform its activities of daily living, which includes tissue repair, and it includes just sending out, you're just giving the support to the other manufacturers of growth hormones or growth factors or cytokines that need to take care of business as the cell goes through its daily living. Okay, so once the photon is impacting the cell and can and rejuvenate that mitochondrial respiration and makes more ATP, then we not only have more of the little batteries in the cell for, again, the activities of daily living. We have more proteins, we have more RNA, oxygen is going to be consumed in the process. So that cell goes from more of a sleepy little state, which can happen when we're chronically stressed or in a lot of pain, or with aging that can happen, is that just the cell activity has been just lowered. Another thing that happens in situations of chronic stress is that we get this molecule. The vets will know what I'm talking about, but nitric oxide, and that. So to review, this pretty little ribbon candy-like structure is an artist representation of the cytochrome C oxidase enzyme, which goes through the membrane of the mitochondria. It's a transmembrane protein. But what's important here is that in a healthful state, this is oxidative phosphorylation. So it's a process that puts ATP out by working with oxygen. And oxygen has to bind to this cytochrome C oxidase. If nitric oxide, because of just long-standing stress, if that nitric oxide is just sitting right there on those oxygen binding sites, then that mitochondrion is unhappy and cannot efficiently produce ATP. And remember, ATP is energy for the cell. It's not chi, it's not mystical, it's ATP. It's actually what drives life going forward. Now, the key mechanism that we understand fairly well, at least compared to other mechanisms with photomedicine, is that when we have light coming into the cell, so again, we are applying our treatment, that light, the photons coming out of my machine here, are going into the tissue, and those cells, which are most of them that have mitochondria, the light is penetrating through that cell membrane and into the insides of that cell and allowing a conformational change, because we talked about chromophores, molecules that will undergo a shape or conformational change when light hits them. So they were like this, and then light hits them, and they're like, oh. And then we see that nitric oxide unbinds because it's a reversible binding system, and oxygen is right where it belongs. And that cell, then, that mitochondrion, can happily proceed to the generation of a good amount of ATP, and it just kickstarts the metabolism, that respiratory function of the mitochondrion, and we get normal ATP synthesis. So in summary, there we go from a sleepy little mitochondrion that just can't get out of bed to one that is now happily generating. It's like people going back to work, and the restaurants getting up and everybody's getting back to work. That's what happens in the mitochondrion, and you have zillions of these in you. So laser therapy and light therapy, LEDs, have the capacity to get the system back to functioning. And that's why it's so exciting, because you're just applying light and it should be safe. And if you're not, going overboard on the power, then you're doing a good deed. And so is nitric oxide all bad? No. No, no, it's not bad. No, no, no. Nitric oxide has its own functions. And again, it's a reversible binder to those previous oxygen sites, but it's going to go on its way, and it has other jobs to do. One of the big things with photomedicine is it vasodilates vessels. And when a system is chronically stressed, when there's chronic pain, when there's just sympathetic nervous system overactivation, the circulation is not going that well. It's not reaching all the good tissues. So nitric oxide, it's like, okay, I'll see you, mitochondria, and I'm going to go deal with these blood vessels, and I'm going to relax their vessel walls so that we have more arterial blood flow in, and then there's more venous drainage out. They have more capacity. It also will help shift oxygenation in different parts of the tissue. That gets a little bit more into the weeds than I want to do with this focus for today. But just to finish up that part, the body has these intrinsic self-regulatory systems that sometimes go a little bit offline or haywire, or they get suppressed because of emotional stress or physical stress or drugs or post-surgically or something. And that's where a scientific integrative medicine practitioner comes in, and we do approaches like acupuncture and photomedicine and soft tissue manual therapy or massage and whatnot. And that stimulates the body to get back to its self-healing state. So that's just why it's so much fun. Is we're not, as long as we do it appropriately, we're not hurting, we are helping in many, many different ways. So what does photomedicine treat? All right, so my mnemonic here is spine, S-P-I-N-E, because one of the big things it treats is a spine. And so here's a mnemonic. It's skin, pain, inflammation, and infection. So I gets 2, nerves, and edema. So let's see where that plays out. What conditions do you even think about that maybe don't have a component of at least one or more of these things? So, but first, talk to your veterinarian. All right. So the skin, we have many layers of the skin. We also have the blood vessels. And so we've seen this before. We have the fat and then the muscles and nerves and bones and stuff. So we've talked about what kind of wavelength would be most ideal. Well, we've talked about you need a wavelength that is ideal. And so when you have something like red light, which I've depicted here, that is in the 650 to 700 or so nanometer range, and that is going to be preferentially absorbed more superficially. So we have the artist representation of blood vessels here. We've already talked about hemoglobin. So hemoglobin tends to like red light. It absorbs it. So does melanin. So if we were, or if you were at home and you were going to be treating a wound at your veterinarian's recommendation, like, okay, go home and I recommend that you treat this wound at home once or twice a day, then something with some kind of red light would be optimal for that. If you only had a unit that had an 810 nanometer, 810 nanometers is going to go much deeper. It could still probably work for the skin, but it's not going to be ideal. So that's where, again, these nuances of treatment and photomedicine are important to understand. So skin wounds, what might delay wound healing post-surgically or just after trauma or something? So if there was chronic infection or underlying disease, well, blue light especially, but lasers as a whole, these therapy lasers, help to improve immune function. And so lymphocytes are very stimulated when they get a blast of light like this. So that's going to help with your immune approach. And then underlying disease, if there was a compromise in circulation, well, we already talked about how nitric oxide improves blood vessel, transmission. So it's going to relax those vessel walls. So we actually can improve circulation with photomedicine. We have anti-inflammatory effects. And so for the vets that are on, that's where the macrophages change their phenotypic state from a pro to an anti-inflammatory way of being. And we're going to get also a shift from the pro-inflammatory cytokine release to anti-inflammatory effects. Cytokines have been in the news recently with this COVID 19 thing and that hyperimmune response to the virus, and how you can get a cytokine storm. And we just think, okay, when things start to calm down and all, could photomedicine help? Or maybe do it right now because things aren't calming down that quickly. But anyway, there's ways that we can work with the body to help it recover and to help it deal with things, and then tissue repair capacity. So this guy here was a dog that I had seen when I taught at CSU, and he'd had a right forelimb amputation due to bone cancer. So that the bone cancer was gone. Then he had orthotics on the left forelimb and the right hind limb. On the left forelimb, because when he was getting chemotherapy for the cancer, it extravasated, so it came out of the vessels and it just tore up his forearm there. And the right hind limb had Pseudomonas in it, and I forget why he had a brace on the right hind limb. But anyways, it had methicillin resistant staph infection in there. And so that just wasn't going anywhere. And of course, I didn't take a picture at the outset of my treatment here, but this was about how big the lesion was at first with this methicillin resistant staph. And then that was probably after about 2.5 or 3 weeks of probably 2 to 3 times a week laser. And if you saw it in the background, I was using an early companion laser device then, and that really didn't have much of a red beam, or it didn't have any blue. So, but it's what we had, and that was a great way to get started with laser. But you can also see here some of the other changes in the skin, possibly because of just the wear and tear on his system. It turned out eventually that he had osteomyelitis, and we weren't treating for that, and all. So we got to a certain extent, but there was a much deeper infection that was still the problem there. And this was one of the first patients I treated with photomedicine when I was at CSU. And you'll see here, this is just a cat toy laser. So it's red. You can see that beam there. And so that's in the 650-ish range. When you look at the little cat toys or a laser pointer, you'll see on the side a little warning on there. And that'll tell you about what the beam wavelength is and the power. So it's less than 5 milliwatts. And it's in the red visible range. And this bird had been abused, and so somebody else got the bird and was caring for him. And he had been feather picking and had really traumatized his abdominal region here. And then I have some acupuncture needles as well. And this was either the first or second patient that I started using laser with. And again, it's a little cat toy type. So nowadays I'd be much closer, but I figured it's supposed to travel, so that would be okay. And the wound would keep healing. There was, and it was closing. There was just still some behavioral aspect there that is always another thing to deal with when you're treating feather picking. But here again, you can see these acupuncture needles. And for those of you from my acupuncture course, that's from Stomach 36. So that was my treatment. And that is something that I have instructed bird people to use at home and to continue at home, and sometimes that's been very helpful. And this is just an expanded view of the little sign on the side of another type of, it's a similar laser little beam that I would use. So that's like $12. You can buy that at any store, as long as you wear your mask. So then there's wounds, acute or chronic. So wound healing was actually one of the first applications of laser therapy. And actually, a lot of the research came up after the Chernobyl accident in Russia. So even though that was radiation, they were treating a lot of those burns with laser therapy, and so that got it started quite a bit. Um, but with wounds, how is it working? It's promoting new vessel growth. It's increasing collagen synthesis. So again, you get the ATP going, and that's going to help feed all these other activities that are generating tissue repair, new cells, new blood vessels to feed those cells, and so on. So with wound healing, though, this is another situation where you really want to have not extreme amounts of laser beams there. And this is a perfect place to use LEDs and the red light, and just to help with these various stages. Once the bleeding is stopped, then we can deal with the inflammatory, the proliferative, and the remodeling phases. And there is research on each of these stages. So because this is client oriented, I'm not going to go into a lot of the research, but we do that in the photomedicine course that we'll talk about a little later. But yeah, but just looking at in this study, a variety of beams and seeing that the 600 nanometer, so the reddish range, or the near infrared 800 nanometer range seem to be most beneficial parameters. And when you're really trying to get a wound healed, you might go daily. So this is just referring to the different types of cells that love the light. And so harkening back to when you don't use this, if you had lymphoma or leukemia or something, you don't want to be shining light on cells that already love the laser if their cell division is out of control. So that's why you talk with your veterinarian and come up with a treatment plan for who that animal is, where their pain is, what their problems are, and what the best device would be for you. We talked about other effects already, and just more oxygenation, more blood flow, activated immune cells, and I mean humans have caught on to a great deal, whether it's for skin health, and we already talked about the acne treatment with the blue laser, or now they have those hair growth devices. It's a helmet with similar types of LEDs, and just going for on in in your scalp to get those hair cells producing more again. And maybe in those cases too, it's not bad to get out in the sun without a baseball cap on or something, considering that you have to be careful of the UV lights. This is one of our acupuncture course graduates' pictures. This was a corneal ulcer in a tiger that she was treating. She worked on Hollywood sets and would help with retired circus animals, and just really great person that was caring for a lot of big animals. And you see here that the tiger is just enjoying, I think, his Espalac or something, kind of puppy milk replacer. And she's able to use an LED cluster for that corneal ulcer, and things are going well. Don't do this at home. So when we're talking about power, I'm emphasizing that it's just like watering a plant. Do you water slowly, or do you just dump a bucket of water onto a potted plant and have it splash all over, and it never gets deeply in there? So one of the good things about lower intensity treatment is that you are able to gradually work with the tissues, and they are able to um, have a different biological response to a more gradual type of treatment rather than just blasting it. The idea from some of the class 4 manufacturers of lasers, so class 4 is where the beam is over 500 milliwatts, but you're getting into 15, 20, just really high levels, even much more, for small animals, and that's just too much. And the selling point seems to be that, oh, you get your treatments done really fast and then you go on to the next one. Well, that's not the kind of medicine that I teach or promote, so I'm not even going to go there. But just even to support the fact that red LEDs can help with spinal cords, if you're treating rats, this is where LED photobiomodulation reduces pain hypersensitivity and improves sensory motor function following mild T10 hemicontusion spinal cord injury. That was experimentally induced, I'm very sorry to say. But just depending on the size of the individual you're treating, or if it's your own animal that you're looking at and you have a red LED device, which is this one. Okay, close your eyes if you're going to have a seizure, but that's what it looks like. probably just blasted my webcam to bits. But that would be where if this was the back, then we're just going to be treating over the back. And ideally, for spinal cord injury, we do want typically something with 810 nanometers, 810 to 830, which is the near infrared, and you would not see that. But it's just nice to know once you dig into the literature or you take my course or whatever. I mean, once you actually look at the papers that are out there, you see that there is so much flexibility in the types of treatments that you can offer. The light is very forgiving. Just don't be turning it up too high and burning patients or whatever. And then if you are interested in the science of this, Mike Hamblin, who's at MIT, Massachusetts Institute of Technology, at the Wellman Center for Photomedicine, he is, to me, the real big leader in the photomedicine field. He's been doing it forever. And so look for papers by him, but here he talks about mechanisms and applications of the anti-inflammatory effects of photobiomodulation, which is a lot of what we're interested in. So photobiomodulation, analgesia. How do we use light if we are going to help with pain? Well, what causes pain? Well, there could be inflammation, and then there's irritation of nerve endings. Again, these inflammatory mediators. We have the nerve endings all riled up. We might have a decrease in circulation there, so there's some ischemia there. And so what the light is doing is helping cut down the inflammation. And again, we've been through this. Improves the circulation, and it helps with neuromodulation. Actually, helps the nerve be happier in that region. And actually, those spinal cord segments, if you're going to treat those as well. There are also neurotransmitter changes. So changes in the production of serotonin, the synthesis of opioids, and then it helps to reduce the conduction of impulses along the nociceptive or pain-producing fibers. So this is Eddie and Buster. These are two of my patients that would come down from a couple states away for treatment, and they both had arthritis, but in different places, and they would just sit there with each other. And this was a screech owl that I helped work with the Raptor program with. And the screech owl that was hit by a car had some shoulder injury. And here I'm using that was a 500 milliwatt head with an 830 wavelength. And then, as you can see, this was not the ideal treatment. This was a 4 watt, they had 4 1 watt diodes for those of you that are vets. And it was 810 nanometer wavelength. So much more for like a dog or a person with spinal cord or nerve injury, but it's what I had that day. So I adapted, and I had some other machinery that I brought later. But there was a whole bunch of beam there going past that bird's leg and into my hand, which was fine. And then there's treatment of dental pain. This is post-operative, whether you go through the cheek or inside the mouth. So again, we're talking about what can be treated. And here's for spinal cord injury for animals. I've mentioned that a couple times. And so with humans too, it can be a life or death thing for different reasons. But with animals, if they can't walk and they get a disc injury and spinal cord injury, and if they are incontinent and they're just not able to maneuver around the house, that could mean euthanasia for some. There could be a veterinarian that might recommend that if they don't pursue surgery quickly. With Curacore, we don't go along that route, and we know that the mechanisms of spinal cord injury are your first primary phases and then your secondary phases, and the secondary things like the inflammation, the circulatory challenges, and just the way the nerves kind of go haywire, that all of those are really receptive to photomedicine, to acupuncture, to integrative rehabilitation. So our aim would be to get them walking again, and photomedicine is an important part of that. This was a study from University of Florida, the neurologists, where it was actually after surgery, but they applied, this was a Thor device, it's class 3B, and they published this. But as I said here, dogs that receive low-level laser treatment after initial surgery are walking a full week earlier than patients that do not receive the treatment. So, given that, and given the biology of spinal cord injury and the photobiomodulation of naturally occurring as well as the experimentally induced stuff, given what we know about photomedicine's ability to improve spinal cord health and recovery, why is this not standard of care? Whether or not you're doing surgery, rapid treatment with photomedicine and the other integrated medicine approaches, a scientific approach to acupuncture and even certain herbal approaches. We can talk about cannabis another time again if you'd like, but anyway, there's so much that can be brought to bear instead of just putting somebody in a really bad predicament, saying it's surgery or really high dose steroids or euthanize them, because that's your only hope. And so that's not true. So Deanna, again, great question. Thank you. Can you explain how the blue light helps with skin issues or wounds? Blue light. So we could talk about blue light in the context of this dog here. So let's say this was a down dachshund, and obviously probably post-surgically based on this, and because of the website they came from was an IBDD site. But so skin things are part of spinal cord injury. So what happens? There's the spinal cord injury, so we want to attend to that with photomedicine and related techniques. There's the muscle damage. There's the muscle wasting. There, especially in humans with spinal cord injury, there are cardiac complications. There's often an abdominal situation, maybe that the animal is on opioids or some other kind of medication and being non-ambulatory, that the GI tract isn't working so well. There could be urine scald. There could be infections developing back here. So we would want, just for the ideal thing, we'd want some red light for the groin area, if this was, or decubitus areas where there were pressure sores coming up. We'd want our 810 nanometers or 830 that will penetrate best into the neurological area. We're going to want to do a full myofascial palpation evaluation and make sure that we're treating all the areas of tension and pain. So this is a whole individual treatment that uses multimodal scientific integrative therapy and rehabilitation. And so with blue light's focus in terms of a therapy laser has been mostly with the anti-infective potential, and blue light does not penetrate very deeply. And so that's where I would probably integrate a red and blue alternating light for any infectious diseases. And I don't think it's completely clear how it works anti-infectiously, other than the fact that it has something to do with the bacterial replication and inhibiting that amount of replication. But still, there's a lot of questions with blue light for infection in terms of what the intensity should be and so on. So that's kind of another discussion, but we do cover that more in depth in the courses. Because if you are shining a blue light on a petri dish of bacteria, there's going to be a different dose, a different intensity of light in the center where that spot size is going to focus, and then it's going to be different in the outside. So you might be inhibiting with a stronger light centrally, but what are you doing with a less intense light? Is there any kind of regrowth there? I don't know. So there was definitely questions, and that's a very insightful question. So thank you, Deanna, for that. So just all these things that we want to be thinking about, and the photomedicine is not a magic cure for all of them. It is helpful, but the acupuncture is really going to be what drives the nervous system to a better recovery and a better state. And then our integrative rehabilitation can help them, help just the motor part of all that and the coordination and linking up that sensory and motor together again. This is, again, a picture from Jenny Conrad, who was working with a tiger. This was a gull that had acute brain injury and probably some bleeding. She got this is her 1 watt, I believe, Thor laser on the head, and he went back to the beach. She's in California. And then here was I think the crows getting up on the squirrels, and they dropped them. Like this was a young squirrel. And And I think that crows gang up on squirrels and harass them and make them go into the street and get hit by a car, and then they can eat them. That's my feeling. But anyway, this was a baby and he was dropped from a crow, as you can read here. So he got a combination of laser and acupuncture and tore up all the wood in their house, and then I think was released. And so, Luana, you asked, thank you, is there a color of light that can help neuromodulate the brain for pain management? Um, you know, I'm not sure that I would focus on the brain for pain management, but still any nervous tissue is more that sweet window, where the light gets through the best without being absorbed by higher tissues, like more superficial tissues, is 810 to 830. So that's usually what we think about. But there are studies out of MIT that look at red light, and actually they kind of take a red LED, I think, through the nose, and that gets into the brain. So lots to look up. If you go to PubMed.gov and look up photobiomodulation and brain injury or pain, that could be fruitful. There are other search terms if you want to email me. Any questions that you guys want to email us about, just go to info@curacore.org and I'll show you that. We're just going to wrap up pretty soon. But these are some other conditions that we can apply the photobiomodulation for. And again, different depths and types of tissues, and we want to be comprehensive. And so cranial cruciate ligament disease, I'll be talking about troubling things about the TPLO in a few weeks, and how misunderstood this condition is, and how it really needs a shift in approaches and a much more comprehensive diagnosis and treatment. So, but there's so many different ways that light and acupuncture and all these other things, but we're talking about photobiomodulation. If for some reason they ended up getting surgery, especially a TPLO, unfortunately, then you'd want to treat the wound. You'd want to be treating all the stuff that was cut apart and needs to heal and regrow. And that's a whole nother webinar. Anyway, so how would you treat your animal? Well, the treatment approach is going to depend on the diagnosis. Make sure it's not cancer. See your vet. Wear eye protection if warranted by the device, and avoid flashing lights if you have seizures. But yeah, did you talk to your vet yet? So that's how you would treat your animal. If your vet doesn't understand photobiomodulation, then maybe find somebody that does, because I'm not your vet and I can't tell you, because that animal needs to be diagnosed first. All right. So just for some practice, where would you treat this dog? Hey, this is not my patient. This is a stock photo, but it illustrates the complexity that we really need to bring to any patient, and for me as a physician as well, human or animal. Just looking at this dog, okay, I would definitely want to palpate. There's a physical exam piece that needs to happen, but just looking at this dog, how comfortable is this dog, do you think? And as I instruct my students, start from the head all the way to the tail. The eyes, I cut off the humans' heads here, but they were all happy and reading and having a fun-loving time. This dog is concerned. Just the way this dog looks, look at the heaviness, the thickness of the body. Look at the fur coat, and how what I also teach people, you watch where the transitions are. There's a big transition here. We'll look at some other dogs, but this dog looks like the body is heavy and tight and thickened, the elbows. So I would be palpating all over and really finding out what is going on. Is there a neurologic piece, or is there a myofascial piece? So it would be wrong for somebody to say, even if Dad over here brought this dog in and say, "Oh, not jumping into the truck like you used to. I think it's his hips." So what are you going to do as a veterinarian? Are you going to just focus on the hips because Dad thought it was, or maybe the other vet thought it was? Ideally, no. You're going to want to examine this animal, do if imaging or other appropriate workup is needed, if thyroid test, okay. But your hands will tell you everything. And so even if you're a client and your vet said, I don't know, probably a hip problem, it wouldn't be sufficient, because this dog has so much more. You can just see that. And then we have another one. You know, does this dog look happy and healthy? Not to me. We can see that there's an abnormal curvature. We call this a lordotic curvature here. what's going on here? Just things aren't right when you look at the posture, and this is a whole other exercise as well. But this requires real good assessment into what is going on. Where is the pain? If there's pain, where is the restriction? What's going on in the dog's life, socially, environmentally, exercise-wise, nutritionally, everything. Dog doesn't look like it has the happiest expression here, and just even looking at the way the head is positioned on the neck, I'd be concerned about some kind of neck and head pain. Is there a problem with neck extension that's causing some headache there? So, so the take-home message there is we should be expecting so much more out of a physical exam, out of a veterinary visit, and you can't do that in 5 minutes. You need, ideally, the way we're recommending it, you need a half hour to a full hour, ideally a full hour, to sit with and recommend and understand that patient and what what the diversity of problems are, because too often in veterinary offices, somebody comes in for, let's say, an annual exam, or you need a vaccination or something. If the vet says, "How's it going?" A client says, "Oh, fine," because you just haven't been educated in really seeing what's going on. Then that animal never gets the help and the attention and the intervention. So yes, we have all kinds of treatments, but first thing is finding out what's going on. Where is it? What's the nature of? What's the source? And you don't usually just have one thing. It's like, okay, there's the hips. Well, if the hips are a problem, what are the forelimbs doing because that weight is shifting? But is it really the hips, or is it a neurologic thing, or is it both? So anyway, I haven't dissuaded you from looking into this more, but it's a partnership with your veterinarian who is educated in this. So what I showed earlier, I don't have my webcam for some reason up, so I can't see it, but I think you can probably see this. So this was the green light, and I don't like to look at the flashing light, but this is the LumaSoothe, and I got you the website there. I don't make anything off of this, off of saying it, but it's so cute, and it has a little plug-in. It has a micro USB thing, so you can warm it up back. You can charge it back up, and it only sort of does this. Off on, and so you don't get a lot of versatility there. But what you do get is a second thing. If I can do this efficiently, I practiced, so I wouldn't take much time. So we have a second head as an option. So that other device, that other head with the 900 and something wavelength as the near infrared, as well as the green, that's for more deep problems. For some reason, this isn't going on that well. Probably have it upside down. Probably a 3-year-old could do this. Anyway, you'll have to maybe believe me that you just have to get the hang of it. Anyway, this other head, satisfying clunk. Ooh, isn't that pretty? I'll show it to you real quick. See that? Isn't that pretty? Ooh, there's so many different colors in that. So that's more superficial. There was a yellow, I think there was a blue and a red. That's more for superficial. There's not that much information research-wise on yellow light, but probably if there was a wound, I would use that. So this has, through the whole area here, has over 2 watts of power. And so it's not extremely low, but that is diverted across this whole spectrum here. So treatment typically goes that you just leave it in one place with not that much movement for about 10 or 15 minutes. It has a self timer. And so if somebody's sitting around with their animals, it does get a little bit warm. And I've had clients use it on themselves as well. And so it's nice, but you have to use it enough so that there's enough photons that get into things. This other one, this is the Tend light that I've been showing off and on because it's so pretty. And so this is FDA cleared, and it has 1,500 milliwatts of light, but you see it's a much smaller spot size because it's not so big a head, so it's more concentrated. And you can actually feel this warm up faster. And it's just the red light, though. It doesn't have anything else, and it's a continuous beam. So there's that. And then I don't have one of these to show you, but I have the more professional version of that. And so this is what we get into with super pulsed power. where it does say 15 watts, but it comes out as a nanosecond. So it's not injurious. This is a 1M device, and so it doesn't have that eye protection full requirement. You just don't want to stare at it again. But it has, being that it's from Multi-Radiance company, it has multiple radiances. So it has several different wavelengths already built in, it has different pulsing levels and treatment modes. So if you are interested in that, I don't know the price of that offhand, but if you contact us, you can contact us at info@curacore.org, because Dr. Yuki, who helps lend us lasers for our acupuncture courses and our massage courses and our photomedicine courses, that she's been great and she works with us, and we could probably get you a special code if you're interested in that. So info@curacore.org. And if you want to just go to the site and look for some more specifics, again, I don't make anything off of this, so it's up to you. But this second area here has some tutorials. Again, this is not my company or whatever, but it has some suggestions that you might want to look into. And this is just an example of how everybody's relaxed here. Nobody's holding anybody down, and it should be an enjoyable treatment. Even for the class 4s at the vet office, should not be a scary, hot treatment. So if your veterinarian agrees, it might be reasonable and safe for you to provide photomedicine at home for your animal. At first, obtain a diagnosis, a good one, spend a lot of time, and then devices vary widely in power. So you see here, the first two are under $200. So it's just fun to use, and it's nice, especially if you have a cat practice or a smaller animal. But really, the Tendlite, I believe, is a human device, and for more sports medicine kind of applications. The higher power they tend to be more expensive. If you are somebody that is looking as a vet or a vet tech for a course, you go to our website, curacore.org/vet, look under courses, and then our photomedicine courses. We have one that's on site later this fall, that's a full day. And then this is the online one. These are just screenshots of the brochure, where we go really deeply into the science, which I love to do, as you might know that. And so, yeah, ask us questions, info@curacore.org. There's our Instagram, there's our Facebook. Thanks for joining us, and I don't see any more questions, so I guess we'll end here, but looking forward to seeing you again next week. Thank you.